Hereafter, a set of exercises is presented for patients admitted to hospital with COVID-19, presenting mild or moderate symptomatology, in those cases where ventilatory support is not required, and providing that there are no contraindications such as the ones described in the clinical practice guidelines consulted. In no case shall those guidelines established by health professionals in direct contact with patients be substituted or contradicted by this proposal, since they are the ones who know the real situation of each patient. The exercises are presented in order of increasing level of demand according to the position that patients can maintain at each stage of their hospitalization. Therefore, the first and second blocks comprise exercises to be done lying flat, whereas the third block includes, on the one hand, exercises to gradually shift from lying to sitting position and from sitting to standing position, and on the other hand, exercises to be done in sitting and standing position. In this first block, breathing exercises which can be performed lying on the bed are shown. Abdominal or diaphragmatic breathing. It helps reduce breathlessness and relax. It enhances ventilatory mechanics by improving lung ventilation and oxygen uptake. It improves heart dynamics and circulation. It improves bowel transit. To start with, lie flat on your back and put your hands on your belly. Breathe in, trying to direct the air to your abdomen as if you'd like to push your hands with it. Make sure you only move your belly rather than your chest. You can place one hand on your chest and the other on your belly to notice the difference. Try to briefly hold the air in the lungs without feeling any pressure. It's important to do it comfortably without forcing yourself, so try to do it with relative ease. Do not distend your belly like a balloon, and do not try to retain the air, as both things would cause stress. As soon as you feel the need of blowing the air out of the lungs, do it relaxing your belly. It will deflate, and your hands will go down. Hold on for a moment before inhaling, and as you relax, breathe in again when you need to. Do it deeply and slowly. Fill your lungs with air, feeling your abdomen move up. Practice diaphragmatic breathing for as long as you like. You can use it to reduce the sense of distress that often accompanies respiratory diseases, and it will help you oxygenate more effectively. Once you have a good technique, and if your situation allows you, you can practice it in sitting pose, standing, or even moving around the room. Thoracic or ribcage breathing. It enhances diaphragmatic breathing, which has been practiced in the previous exercise, in cases where it is weakened. During the course of this exercise, it is important to avoid sitting or being reclined with a hunched back, as it would cause pressure on the ribs and hence prevent us from breathing well. This exercise allows us to develop awareness of this breathing phase. However, it is less relevant than the previous one since it is less efficient. Lie flat on your back and place your hands on your ribs, one on each side. Breathe out deeply and contracting your abdomen, trying to avoid belly breathing. This exercise has already been practiced before. Breathe in slowly and deeply so that your rib cage can expand. Notice your hands moving upwards. This exercise requires more effort to breathe than in the case of abdominal breathing. Nevertheless, as long as you do not have muscle fatigue or chest pain, you will get the right amount of air in your lungs. See if you can hold your breath briefly and begin to breathe out slowly, noticing how your rib cage goes back to the initial position as you blow the air out of your lungs. Breathing control. A breathing cycle, breathing in and breathing out, takes place from 10 to 12 times per minute. This rate may increase with certain diseases of the respiratory system, which would reduce the time that the oxygenated air is available for our body. This technique will allow us to improve the time it takes the air we breathe in to exchange gases in our body when we have rapid breathing. This exercise consists of a slight variation in the abdominal or diaphragmatic breathing technique, which we have previously practiced. Start by placing both hands on your belly. As you have already learned, breathe in, trying to direct the air to your abdomen, noticing how it pulls your hands up. Although rapid breathing may prevent you from holding your breath briefly, don't worry. Focus in the process of breathing out. Do it inflating your abdomen, blowing the air out through your mouth, and narrowing its way through your lips, as if you wanted to gently and slowly blow out a candle. While at the same time, you can notice your hands moving down. This technique will be very helpful in the event that your breathing becomes faster than usual. It will help you reduce the sense of distress that often accompanies respiratory diseases, and it will help you oxygenate more effectively. However, you should arrange it with the health professionals responsible for monitoring you. Sudden increased breathing rate would require you to stop doing the exercise and to consult your case.